My name is Charles Bookwalter. I am a former Bronze Star winning senior Special Forces medical sergeant, a senior sales representative for Intuitive Surgical, and a local business owner that was impacted by the government's response to COVID. I'm representing myself, my family, In Libertas, and Free Hoosier families. I think it's time that Indiana politicians start acting like they care about freedom. We should not be promoting a one-size-fits-all healthcare solution in Indiana that was recommended by all those testifying previously in support of SB 4 today. And this is all about how rural communities responded to state mandates in the COVID period. So before we go approving the state have more authority over healthcare or provide 2 times the funding for it, we want answers first into what was the cost of the state's reaction to COVID. And like I said, this commission was all about the response to COVID as testimony from Senator Kenley in the public hearings. We're pretending that there wasn't a cost. There's an assumption in this room right now that the COVID crisis would have been better if government had more power. Does anyone actually believe that now that we know vaccines don't stop transmission? Now that the CDC lied, that masks don't work? Now every day there are more and more cases of young people suddenly dying? Now parts of the Indiana economy, like my small business, are destroyed? Save healthcare, which is not, which you heard from the testimony today by all those in support of it. Most politicians with too much responsibility and too little accountability will always default to safety. And Indiana political leadership completely bungled the COVID response, and the governor and his public health commission want more money, more power, and more responsibility. I speak for myself and probably a majority of Hoosiers when I say I'd rather have Ron DeSantis as governor of Indiana than Eric Holcomb, because DeSantis proved that this so-called 100-year pandemic was nothing more than a pretext for the biggest theft of the public treasury and loss of freedom in our lifetimes. That is the tragedy of COVID, is the loss of freedom, the debt, and the incalculable damage done to humans, particularly children. We need diversity of thought and diversity of ideas to see how things play out in a crisis or an alleged crisis. If you really want to craft an intelligent bill about this, it would be done giving more independence to county boards of health, or even encouraging them to implement different approaches in a pandemic so we can see what happens, so we can follow the science. Because without the opportunity to dissent and be proven wrong, government mechanisms don't self-correct. And I think a former Republican state senator knows that. Which makes me think that this legislation is more of a cover-up, creating mechanisms so that you'll never be caught harming the people again like you are right now. SB 4 is an attempt by the Indiana leadership to circle the wagons and tighten control mechanisms for the next pandemic so they won't be in the position you are in now, which is probably frightening for some of you. Everything would be better in our country and state if we had less top-down control, not more. Because when there is enough freedom that there can be a diversity of approaches between parts of the country, that's when there is a possibility of accountability when you get things wrong. And that's what, Senator, the legislature is the marketplace of ideas, Kenley, and the governor's Public Health Commission do not want. They do not want accountability here. That's the end of my presentation.
Thank you very much.